All right, today we are diving into a fear that is, let's face it, almost universal: the dentist. But what if I told you that a huge chunk of that fear is built on a myth that's about 100 years old? And that right now, technology, from simple videos all the way to virtual reality, is totally changing the game. Okay, let's get into it. You know the feeling, right? You're watching a scary movie, your heart's pounding, you're jumping at every little sound. But for literally millions of people, there's something out there that gets their pulse racing way, way more. Yep, that's the one. Just the simple act of leaning back in that chair can be more terrifying than any Hollywood horror flick. And a lot of that deep-seated fear, it boils down to one single procedure that's been surrounded by decades of just plain wrong information. So, where does all this anxiety actually come from? Well, it turns out a huge part of it is rooted, no pun intended, in some very old and very, very debunked science about root canals. Let's dig in and see what's really going on. Okay, so take a look at this timeline. It all kicks off back in the 1920s with a guy named Dr. Weston Price. He published these studies that honestly were really poorly designed. We're talking bad controls, unsterile labs, the works. And they created this scary link between root canals and other diseases. It wasn't until 1951 that the American Dental Association officially and publicly debunked it all. But by then, the damage was done. The myth had already taken root. So let's bust myth number one. The idea that a root canal is this super painful procedure is, well, it's completely backward. A root canal isn't the cause of the pain, it's the solution to it. The whole point is to get in there and remove the damaged, inflamed tissue that's causing that awful toothache in the first place. And get this statistic just says it all. A survey found that people who have actually had a root canal are 6 times more likely to call it painless than people who haven't. It's the fear of the unknown that's way scarier than the reality. With modern anesthetics, it's usually no more intense than getting a simple filling. And now for that other big myth, the one that Dr. Price started. The bottom line is this: there is absolutely zero valid scientific evidence that connects a properly done root canal to any other illness in your body. In fact, the whole procedure is designed to eliminate bacteria from the infection, which makes it incredibly safe and effective. And finally, there's this idea that, just pull the tooth, it's easier. But that's almost never the best move. Nothing, and I mean nothing, works as well as your own natural tooth. Plus, pulling a tooth can cause other problems, like your other teeth shifting around. Saving your tooth has a super high success rate, and it often costs less time and money than getting it pulled and then replaced with an implant. Okay, so if these old myths are the problem, what's the solution? Well, it's actually pretty simple. You fight fear with facts. You fight the unknown with clear, accessible, and, engaging information. Think about it. When you actually understand what's happening in a medical procedure, why it's happening, and what you can expect, that feeling of anxiety just plummets. An informed patient is an empowered patient. And there's one modern tool that's proving to be a total game changer for this. This number is just wild. When you give patients a choice, a whopping 97.6% of them would rather get their health information from a video than from an old-school paper brochure. Why? Because they say it's clearer, and it really boosts their confidence in what's about to happen. And it's not just about what they prefer, it's about what actually works. This chart shows it all. When patients watch animated videos, they are over 3 times more likely to actually remember the critical health info they're being told. That is a massive difference in understanding. And here's the best part. That understanding leads to real-world change. One study found that after watching educational videos, patients showed almost a 40% jump in using cleaning aids and big drops in eating sugar and smoking. And check this out. These weren't just one-day changes. They were still sticking to them 4 weeks later. This quote from one of the researchers really just nails it. Video isn't just something you passively watch. It's an active tool that actually educates people and motivates them to make real, lasting improvements to their own health. So we've gone from busting myths to educating the mind. But what's the next big leap? Now we're moving to the real cutting edge, where the goal isn't just to explain the procedure, but to literally change the patient's reality while they're in the chair. And for that, you have virtual reality. I know, it might sound like something out of a sci-fi movie, but VR is becoming an incredibly powerful tool in hospitals and clinics. It can transform that dentist's chair into, well, pretty much anywhere else you'd rather be. So how does this actually work? The science behind it is this amazing concept called immersive distraction. The idea is by completely taking over a patient's senses, sight, sound, in putting them in a different world, like a calm beach or a beautiful forest, their brain just has less bandwidth left over to focus on the dental procedure itself. This is where it gets really cool. It's more than just a simple distraction. First, VR puts a huge cognitive load on your brain. It gives it a lot to do. It also actively shifts your emotions toward feeling calm. And finally, based on something called the gate control theory of pain, it floods your brain with so much new sensory information that it literally closes the gate on pain signals trying to get through. And we can see this happening. We have the proof. Functional MRI scans actually show that when someone's using VR, the pain-related activity in 5 key parts of their brain goes way down. So the big takeaway here is incredible. VR isn't just tricking you. It is fundamentally changing your brain's response to pain on a neurological level. It's literally like hacking your own perception. Now, of course, it's not the perfect fix for every single situation. This chart gives a really great balanced view. On one hand, VR gives you this incredible level of immersion and a really consistent experience for every patient. But on the other hand, the traditional methods, just a calm conversation or listening to music, are still way more affordable and easy to access. That high price tag on a VR system is still a real barrier for a lot of smaller dental practices, at least for now. So when you look at the whole picture, the journey to tame dental anxiety is really a story of progress. It starts with correcting misinformation from a century ago. Then it moves to empowering patients with knowledge. And now it's entering this incredible new phase of immersing them in a different reality. But through it all, the goal has always been the same: to turn that feeling of fear into a feeling of confidence. Which, leaves you with a pretty fascinating question to think about. As technology like VR gets cheaper and more common, we might be a lot closer to that reality than you think. The idea that a dental visit could actually be a relaxing, or maybe even an enjoyable experience, that's not really a fantasy anymore. Thanks for tuning in.